I'd like to begin this podcast by acknowledging the Yagara and the Turrbal people as the traditional custodians of Meanjin, the lands on which our podcast is recorded. We pay our respects to elders past, present, and emerging.
Hello, Academy Associates. Thanks for choosing to listen to the BodyTrack Academy podcasts, where our aim is to bring clinical research to real-life clinical practice. For further learning opportunities, why not access our educational webinars? To access these, click on the link in the show notes. To further keep up to date with what we offer, why not join our Academy mailing list where you'll receive exclusive content, discounts on webinars, and more. Again, you'll find a link in the show notes.
Here we are with another episode on the BodyTrack Academy, and we welcome back Caitlin Clark, our clinical team lead in women's health and oncology. Caitlin, welcome back to the pod.
Hi, Dan. Thanks for having me again.
Well, this time, instead of going into some women's health, because we have touched base on that in the last couple of podcasts with various exercise physiologists, we're going back into oncology. And specifically, today we're going to talk about some head and neck cancer that Caitlin has been treating and also doing some research on as well. So without further ado, we might go straight into the topic itself. And Caitlin, just give us a broad overview of some head and neck cancer types that perhaps you've researched, come across, or you've actually treated.
Yeah, so the umbrella term for head and neck cancers will include tumours, particularly squamous cell carcinomas, so your SCCs, but can also include adenocarcinomas to areas including the oral cavity. So that's anything from the lips, tongue, roof of the mouth, the jaw, or the gums, the pharynx, the larynx, voice box, nasal cavity, salivary glands, as well as skin on the head and neck. But it doesn't include brain, muscles or bones of the head or neck, eyes or esophagus. So, there's a little bit of a distinction there from from brain cancer as well. So that's not included in head and neck cancer in the umbrella term of head cancers. No.
Yeah, so good to disassociate the two. And I'm sure, I don't think we've covered one on brain cancers yet as well in our podcast. So I'm sure future podcasts can come out about that.
Yeah, definitely.
As well. Yeah, lots to cover in that, I'm sure. And have you had any kind of specific treatment cases or practical cases with any head and neck cancer patients at all, or come across some recent research about these types of cancers?
Yeah, definitely. And like a lot of it is around really important, high importance around multidisciplinary care and practice, really regardless of the location. It ultimately distills down to who needs to be involved as a result of what type of treatment has been applied and the effects of the treatment. I think that's something really, really important to take into consideration is the impacts of the location of these tumours or even metastases to this area can mean there can be some quite consequential side effects and impacts, which means it's really usually quite a comprehensive medical but also allied health team that is assisting these patients. So that's definitely where a lot of the information and research is talking about at the moment is how can we best support these patients in a really established team as well and good communication.
Yeah, so I guess let's go on to that. So treatment types for these kind of cancers, like where do you sort of start with this, Caitlin? Because I'm sure we know exercise is going to play a strong role in this, but with this type of cancer, I feel like there's probably some difference to other ways that we would treat cancer that we do get presented with, say breast cancer, testicular, or those ones. So is there actually a difference in treatment that you go through yourself, or what is recommended from the research?
In terms of exercise, Dan?
Yeah, in terms of exercise as well. And like, someone coming to see an ex-phys and how they would approach that initial assessment. Is there a kind of a different angle or recommended research around the type of treatment we should be providing?
Yeah, definitely. And probably the exercise protocol that's applied is typically quite different for this population I'll go into a little bit more detail probably around a little bit around the side effects as well, because it does depend on how they've been impacted in terms of like their nutritional intake or their malnutrition or malabsorption as a result, or impaired eating, swallowing and chewing can really impact their nutritional intake and malabsorption, as I said. So we can understand then how that might impact on the ability to maintain or promote improvements in lean muscle mass or hypertrophy, especially if there's chemotherapy in the picture as well, which we know systemically can accelerate that decline, as well as having a period of reduced energy intake either post in the acute phase during treatment, but also following as well. So that means we usually have a bit of a different approach from an exercise point of view, usually around impacts that the individual has gone through in terms of how we would adjust exercise. But yes, the approach is definitely on a bit of a different sort of spectrum compared to some other cancers.
Yeah, for sure. And it's good to cover that as well. And I guess some key things that stand out there, what questions you might want to ask, we've covered there really well. That's the differential diagnosis, I guess, for these types of cancer types to others as well. So you mentioned side effects as well, particularly for these types of head and neck cancers. Can we just talk a little bit about those in details, and perhaps how a patient might present in saying, and perhaps layman's terms as well, so we can kind of draw the two together. So if an exercise physiologist is sitting in that room with someone who's presenting with this, then they can pick up on those key layman terms to then looking up on research and applying the best practice for what that actually means.
Yeah, definitely. And I think and another reason for this podcast that we were thinking is when I did recent PD on this, there was a few terms, clinical terms I hadn't come across before to describe different head and neck side effects or symptoms that I had to then research further, but then obviously opens up a different pathway in terms of when you're looking at clinical research, but a patient would describe in different terminology. And when communicating in a multidisciplinary team, you do need to have a bit of an understanding of some of those more clinical terms, as well as being able to communicate and understand what a patient is relaying as well. So that's where I hope that today's episode can maybe provide a bit of benefit, but we'll definitely go through some of the side effects that are a little bit more unique to head and neck cancers, and they're typically consequential from either surgery or radiation. So surgery can definitely occur in this population, and because it's sometimes a little bit harder to get a clear margin around the neck or around the jaw, it can mean that sometimes there's a little bit more inclination for either nerve damage or impacts of the lymph node dissection if lymph nodes need to be removed. Those surgical impacts can sometimes mean that facial or cervical or shoulder range of movement can be impacted during or after the surgery, either by nerve damage or nerve dysfunction following, or by the presence of scar tissue or maybe tight skin after having to have that surgical procedure. So that can definitely be an impact, whereas radiation to the head and neck can have its own sort of set of side effects that really impact this population. So when compared to breast cancer, where we get quite concerned about the impacts of the radiation to the chest wall, particularly to the left side on the heart, and the cardiac impacts. With the head and neck, we see impacts a little bit more so around like the ability to swallow or talk or chew, or throat swelling, and different side effects there that are a little bit more unique. So I'll talk a little bit more about those and what they're called, but just giving a little context. Just jumping back to surgery as well, because I think one type that I haven't really come across, but have heard a little bit about, is with laryngeal cancer. And if they have to complete either partial or total remove of the larynx, sometimes they actually have to create a stoma as well. Something a little bit more unique. And if they're having to complete a total laryngectomy, they might have to also remove part or all of the thyroid as well, which will obviously have impacts on thyroid levels as well, which has its own considerations. So it's definitely about understanding, okay, well, where's the cancer located? Where do they have to surgically intervene? And that's a key part of your subjective questioning, is understanding the cancer diagnosis type, the staging, how it's spread, how extensive it is. The treatment they've had to date is really important, as well as understanding what they know about planned treatment, so that you can either adequately help them to prepare in whatever way possible, like physically or physiologically, whether that be around strengthening or improved range of movement. But yeah, definitely understanding what existing treatment has occurred, because that'll really give you a bit of an idea of which side effects to look out for as well. Yeah.
And I guess in this scenario too, this is where I guess the key difference is, from my understanding, to other types of cancers, is because it's not so much a direct impact on a physical element of how we then prescribe exercise. Like, for instance, as I was saying before, or you mentioned breast cancer and maybe some inflammation around that area. We know that then the shoulder range of motion will be affected, and we've got specific milestones to achieve with that and having that impact on exercise. But I guess with the head and neck, it's not directly impacted. There's going to be some, but that's probably where I'm interested to learn more about, if they are presenting with those side effects that you just mentioned. Is there any major contraindications or ramifications that we should be aware of? Can we still train lower limb effectively into the same intensity we've been doing without too much effect on that area? That's the kind of thing I'm interested to learn about.
Yeah, absolutely. And I might try and expand on that as we go through some individual side effects. But I think it ultimately comes down to, how they've been impacted. Has it impacted their nutritional intake? Has it impacted their upper, because it could definitely impact their neck and their shoulder as well. Like, it's definitely not, or even the thoracic is not excluded from this. And I'm working with a head of patient at the moment who had a nerve damage, which means that he has had impacts to thoracic dorsal nerve. So he now has impacts into shoulder function and shoulder range of movement. And this guy's an avid golfer, so that's been a real focus for us. But he also has significant restriction to his neck range of movement due to significant radiation fibrosis around the left side of his neck. So that means that really his cervical range of movement is really limited, his shoulder range of movement is really limited, and his thoracic range of movement is quite limited. So that's where we started, and then we sort of worked up the chain a little bit more, but we also were working on a lot of elements of lower limb and general strength, and trying to maintain general power to give indirect benefits to his golf swing, as well as trying to reduce some of the stiffness and tightness and restriction from the radiation fibrosis and scar tissue. So
and I guess like that. Apologies, Caitlin, to interrupt, but I think that's the message I was kind of getting across as well, is you got to still appreciate those physical elements from what has been affected, but you then do have to do that great subjective questioning about all the other factors that it can affect, like you're saying, with malnutrition potentially, and how that then proceeds into the exercise prescription that you're doing. So there is that definite link there, but it can be a little bit different to your the other types of cancers that we have been known to see a lot more of in this area.
absolutely. And there's more likely to be more side effects that that's not within our scope and we're not directly addressing as an physiologist, but we need to still have a really good understanding of, so that we're either have a good understanding of what kind of treatment or management they might be experiencing with another multidisc or allied health specialist, but also to be able to then, if anything's been missed, to pick that up and to be able to be communicating to the team and providing the right information or handing over to the right professional, providing the right referral to make sure, because sometimes these side effects can start later down the track after they've once they're no longer continuing with routine or frequent appointments with their medical team or their allied health. So it is our role to keep an eye and ear on this as well. So I think that's where we may not necessarily play a direct role in terms of our actual scope of practice, but we need to have a really good understanding of how we can support it, but then how it may also impact the physiological training outcomes as well. Yeah,
it comes down to that clinical responsibility, which has been a key theme in a lot of the podcasts that we've done. We do get the opportunity to see our patients more regularly than a lot of other allied health, and so it is a clinical responsibility to keep an eye on these things and refer to the necessary allied health to provide holistic patient care. Now, Caitlin, we're probably at a crossroads here. Would you like to go down to discuss around those side effects and who to refer to, or would you like to go down the pathway of firstly introducing those side effect terminologies?
I might run through the side effects and then at the same time talk a little bit about who might help out the patient in terms of their
wonderful
referral.
Okay, combined approach, fantastic. I like it. Let's roll.
I'm going to say some big words and I'm hopefully not going to do a bad job.
Feedback, please, listeners. No pressure, Caitlin.
So first one we're going to talk about, and this is not exclusive to head and neck. Most of these aren't completely exclusive, but they're more common. So osteoradionecrosis of the jaw. This is a rarer side effect. It's an impact as a result of radiation damage to blood vessels and therefore reducing blood supply to the area. And that means the bone starts to die kind of around the jaw, leading to pain, infection, and fractures. So this is definitely going to be more along the lines of dental, ENT, or a facial reconstructive surgeon, depending on kind of the extent or how it's impacting the patient. But definitely a speech pathologist and dietitian will likely need to be involved if there is this extensive impact to the jaw, because it'll obviously affect ability to be able to chew and swallow and intake food as well. So that's definitely a bit more of a rarer one, but can happen.
Hey, thanks for taking the time to listen to our podcast, and we hope you're learning a lot in this particular episode. Just a shout out to our sponsor, HGG Performance, which provide very high quality, innovative gym equipment and custom fit outs to enable you to pivot your potential and smash your performance and rehab goals. They are world renowned for their innovative creations in the gym accessory space, including the best-selling ISO Tib LT, Tib Bar, Wrist Axe, and Nordic Bar. And I got to say, we're using some of these equipment in our clinic and finding some great results. Used by professional sports teams, athletes, and coaches worldwide, as well as the military, health practitioners, and apparently even Joe Rogan uses their gear. HGG is a proudly Aussie-owned company that makes all their gym equipment at their Gold Coast HQ. And our partnership with them, we are stoked to offer you 10% discount on any product with the code BODYTRACK10, so you can experience what all the hype is about yourself. So jump over to their website, go to the checkout, punch in the code of BODYTRACK10 to get 10% off on any of their great innovative gym equipment, and start using today. Thanks very much.
And just on that, sorry, before we go on, is that something that can actually eventuate over a course of time? Like it can actually reappear as well, and so it's something again that we should be keeping an eye on.
Absolutely, it's very much less so an acute side effect or symptom So yeah, definitely something to continue. They will be monitoring for this because it's quite a severe side effect and quite a rare.
Yeah.
So it's something that they really try to modify for and look for early clinical signs of, but it does occur. So yeah, something just have in the back of your mind.
Yep.
Oral mucositis. This one's a bit more common because that's just the terminology for mouth ulcers and sores. This one's really common. Pretty much all of the head and neck patients I worked with have experienced this. And it's not just your run-of-the-mill 1 or 2 mouth ulcers that's really kind of hanging around. This is like recurrent, painful, often quite extensive mouth ulcers that can actually impact like their ability to eat, talk, or swallow. So quite often the patients are given pain medications to try and help reduce these, but it's something that can definitely persist after treatment has finished as well. Like one of the patients I'm working with at the moment, he's 4 months post-treatment, he's still experiencing mouth ulcers, and the oncologist advised, like he's been given some topical ointments and mouthwashes and different things. So, like the cancer care coordinator or their clinical nurse can help them out with some recommendations, and they typically will. But yeah, they can take a fair bit of time to resolve as well after treatment, depending how extensive it is. But that obviously impact on nutrition. So if that's something that someone is experiencing, they might benefit from seeing a dietitian that has understanding of head and neck conditions or these small specific kind of restrictions due to mouth ulcers to be able. They would benefit from seeing them for assistance in maybe what types of food to avoid or textures of food to go for instead that might be a little bit more soothing. I think one of the recommendations I've heard is like sucking on ice cubes. It might be for another side effect, but like just simple little things like that actually make quite a big difference as well.
Yeah.
So
okay. Yep.
Another one that's in the similar sort of category is xerostomia. That is spelled Xerostomia. So
you're doing well.
So that one is actually dry mouth and saliva changes, and that's typically because of saliva due to radiation damage to the salivary glands. So it can mean that they have really low production of saliva, or they can have really thick and sticky saliva, which really has a big impact on their ability to chew and swallow. We know saliva is so important for our eating and swallowing functions. So when there's a really kind of low production or really sticky and thick saliva, that can really impact on what types of food someone can eat, how quickly they can eat, how much they can eat, and also confidence with eating, because we're obviously trying to reduce risk of aspiration, where food or liquid can enter the airways and can be quite life-threatening. So there's a lot of impacts there, but then also that thick or low saliva can also impact their dental health as well. So that's a side effect where there would need to be consistent management from a dentist. A dietitian, definitely really important there to make those adjustments to eating, but also speech pathologist is really key here as well. Their involvement is quite important with this one. Yeah.
Okay, interesting.
Yeah.
Those 3 of the side effects, one probably a bit more rare, but then the other 2 can be a lot more common.
Yeah, absolutely. Very common.
Yeah, and I think you tied it really nicely with the allied health that we need to engage with. It's seeming like a dietitian is very much on board with this whole process as well, needing to have that impact. But then, of course, contact with the surgeon or radiologist, oncologist, and all those parties as well, like we would usually have for any oncology patient. Any other main side effects that we should be aware of at the moment for these kind of cancer types?
Yeah. I've got a few. Here's another one that's a bit trickier to say, and then I might try and spell it out, hopefully successfully as well. Dysgeusia, I think is the correct pronunciation. Dysgeusia. And that's actually the distortion of sense of taste. So that one's not exclusive to head and neck cancers. Like you might see with other cancer types as well when they're going through treatment. It's not uncommon to notice changes or alteration to taste, like a bitter metallic taste is not uncommon if someone's on certain types of chemotherapy. But this one can also be not just due to chemotherapy. It can also be due to the impact of the salivary glands, because that impacts how food taste, making it taste bitter or metallic. So that can actually lead to aversions or decreased intake of food. And sometimes that's really common around like different sources of protein taste not as nice, or milk, or different things like that. So then patients start to restrict what they're eating, and then quite often they're then deviating away from good energy or nutrient dense sources of food because of the way that things taste awful, it tastes horrible, has a big impact. And once again, that's really important to be working alongside a dietitian with that one as well.
Yeah, really important to know too, because as you just stated, if it's a deterrent, then it's getting away from the necessities that we need for general muscle building, with being protein and everything there. So yeah, I think that's a really key one to even though it might be hard to say, but a key one to keep an eye out for as well. And with these side effects too, is this something where you are, how frequently are you kind of checking in with whether these are appearing or not? Is it a session by session, and what kind of time frame are we talking here, Caitlin?
Yeah. Definitely, like in this initial is the most important time to get as much information about the different side effects that they're experiencing. Even if you think they're going to be relevant or not, just get them down. Then you can be monitoring them over time. I would usually check in like at the first session after exercise has maybe commenced, after the initial consultation, and then just as needed, as in terms of how much it's impacting the patient. Are they seeing another medical professional or allied health that's likely see them specific for that on a little bit more frequent basis? Then I might not be bringing it up as routinely, but it's something I kind of continue to check in over time, and really good to do at any kind of reassessments that you're doing as well. So putting your medical in your med alerts, or your if you have somewhere that you're kind of recording things to keep an eye on, it's good to just kind of keep those in the back of your mind, and ask and kind of keep an ear out for anything that you think might be associated with those side effects, either being worse or changing or improving.
Yeah. Excellent. Good stuff.
Yeah.
All right. Do we have more side effects? Now, what we'll do as well is we will get a list of these side effects that we can put in the bio, in the show notes. Apologies. So you will have access if you're pausing the podcast trying to spell them out and write them down. Do not fret or do not fear. We can put them in the show notes.
Well, I might spell it.
Yeah.
So quickly. So next one is dysphagia, and that one might be a little bit more common because that one is also consistent with our neuro populations as well. Really key one for speech pathologists and dietitians. So that's difficulty swallowing due to the cancer or cancer treatments, and that can increase the risk of aspiration and choking. They can also experience like shortness of breath when they're eating their meals, or if they're talking for a prolonged period. They might have recurrent chest infections is another subsequent impact of that. But the speech pathologist's role is really important, because they actually can use an X-ray guided assessment to determine if the patient is swallowing correctly or safely. So they have really, really great skills and techniques to be using with that one. And
that's something I did not know they could actually do. That's really good to have our listeners know of. Yep.
Absolutely. And then in conjunction with dysphagia is also Odynophagia. and that's actually painful swallowing. So there's a separate term for painful swallowing when compared to difficulty swallowing, and that's something that I've definitely come across with patients, and they might be prescribed some kind of pain medication to utilize before eating to try and reduce some of the pain with swallowing that can take some time to recover post-radiation or post-surgery. And once again, speech pathologist and dietitian, really, really important there as well.
Yeah.
I might go 2 more.
Sure.
We might go radiation fibrosis. So that one's absolutely not exclusive to head and neck, but it's can be quite impactful in this population. So radiation treatment can impact the soft tissue such as your skin and collagen or your connective tissue, as well as the nerves, blood vessels, veins, arteries, with an impact of progressive fibrotic tissue sclerosis, which means there's a bit of extra excessive laydown of production and deposition of collagen and other extracellular matrix proteins. And that means that the skin or the area, the soft tissue becomes really quite thick and become quite stiff and scar-like, and there can be atrophy of the soft tissue, and it can mean there can be quite significant restriction to that area that can take quite a lot of therapy to improve and may not ever see full resolution or improvement. A trained occupational oncology specialist, occupational therapist, or physiotherapist will likely also be in the involvement of the management of this. Got a few patients who are having laser treatment on their radiation fibrosis because of the location of it, and they've got strategies prescribed by those therapists as well, and then they've been benefiting from mobility and strengthening, lengthening exercises around that area as well. Right. It can impact not only that area, but then up and down the chain in terms of neck range of movement, shoulder range of movement.
Of course. It's interesting, like how, just from learning all these side effects, and I mean, definitely terms of some I've heard of, but some I definitely haven't, and how it all just has this knock-on effect. Things that, like now talking about it, you go, okay, that makes sense, but just this is the value of this podcast, I guess, is having it openly discussed about with yourself, Caitlin, and the clinical team lead of oncology, and knowing this information. That's just going to make that care even more valuable for those going through this, and having exercise physiologists equipped with the right skills to be aware of this. So that's the essence of patient management, really, and having this understanding is really, really great. Now I believe there's one more to go, or
one more. I'm just going to do one more.
That's right.
But just got it. That's so helpful, Dan. And ultimately, like, this is not designed to overwhelm anyone and say, oh my God, don't see oncology. This is really the benefit of this is to try and just help to really expand our knowledge and expand our understanding of what to keep it out, what to look for. You don't have to manage these things. You just need to know, okay, well, that doesn't seem right. What is it? Need to respond to. As a profession, we're trying to just really make sure that we feel as confident as possible. We shouldn't feel apprehensive about assisting these patients because we don't feel like we've got maybe enough skills. We do, as practitioners, have a lot of skills, have a lot of great skills to see a lot of different patient populations, and that's what we really try to get out of these podcasts and also our webinars as well, is trying to make people feel as confident as possible.
Well said, and good summary, because I guarantee you're going to be faced with a scenario where there's a side effect that the patient might say or is written down on a referral to you and you've got no idea. That's not the time to be overwhelmed. It's a time to then be curious and actually investigate this further, because think about the end goal here is it's patient care, it's providing that holistic care. So don't, this isn't designed to make you feel overwhelmed. It's designed to make you feel more curious about what's going on and providing the best possible care that you can.
And it's very unlikely that if you were to ask a patient, if they were to describe something, you weren't 100% sure what that was or how impacting them. If you ask them, okay, well, how is that impacting you? Is that still impacting you? Or is that something that's subsided since the treatment? Then that will give you, the patient will then be able to explain and give you a good understanding. You don't have to know everything about everything. And you also don't want to assume that they've had a really severe impact because of that, or they've had a really mild impact of that. If you ask those open-ended questions, then the patient will be able to give you some guidance about
That's right. Yeah.
what they've been experiencing as well. And that's what can kind of help with your confidence as well.
Yeah, indeed. Yeah. All right, let's fire off with this last one.
Cachexia. So also another one not exclusive to head and neck, but very much common in this patient population as well. So it's a tricky one because it's a little bit more of a multifactorial disease, and the pathophysiology of it is not completely understood, but it is better understood. And there's lots of good research around how exercise actually plays quite an important role in this. And a thing to consider is that it moves beyond the realm of sarcopenia. So it's weight loss, particularly skeletal muscle loss, with or without fat loss due to metabolic, an imbalance in metabolic regulation, and energy intake or nutritional intake can't compensate for that. So it's a tricky one because if it starts progressing along the trajectory towards refractory cachexia where it's not able to be reversed, then that patient continue to experience catabolism to an extent that can result in mortality. So it's something that they put a lot of emphasis on really monitoring for early signs and early indications of, but that we do have actually good evidence around how exercise can play an important role, which kind of goes against the grain in terms of, okay, well, something's promoting a lot of catabolism or energy loss, then wouldn't exercise be contributing to that? And there's actually some really, really good research that I think came out of, I think it's out of ECU, but definitely some of the researchers over in Perth did some really good work on this. And I talk about it in a lot more detail in our oncology side effects series as well. So there's a bit more information on that one and what to do and what the evidence says around that. So yeah, check out that if you want some more info on that one.
Fantastic. I think it's time for a summary. That was content heavy indeed, but for sure we'll be able to provide some details of what we discussed today in the show notes for you to do further research on and enhance that confidence to then to discuss this openly with your patients if you come across these. But Caitlin, if you can give the listeners a bit of a takeaway from what they've listened to today in today's podcast.
Yeah, and so I think definitely understanding that head and neck cancers have some unique side effects and considerations and impacts of their treatment that mean they will very much need the support of a multidisciplinary and allied health team. So you will be needing to work as closely as you can with the team to make sure that you're supporting the patient and their individual considerations or impacts of their treatment, and to understand the different terminology that you might come across in this patient population, both from a clinical point of view as well as from a layman terms point of view as well, to understand from both sides, to be able to understand how it's impacting someone and asking someone how it's impacting them, and then being able to provide the right communication clinically, as well as taking in the right considerations for your prescription. Yeah.
Fantastic. Look, learned a lot myself today already, as I usually do on these podcasts, but that was quite an enlightening one. And look, definitely out of my depth and my comfort zone of clients that I see. So I've been equipped from what you've told me and a bit more aware and confident in approaching it if a client like this ever come my way. But Caitlin, I appreciate your time as always, giving us the up-to-date information about this time oncology, but also women's health. So I think until next time.
Yeah, no, thanks so much, Dan. Thank you.
Thanks for listening. We hope you enjoyed this podcast. So remember to share, like, or follow to keep updated with all our podcasts and educational resources.